My name is Dawne Beamer. I am the Pulmonary Fitness Coordinator here at Monadnock, and I am also a tobacco treatment specialist. My colleague,
I'm Gabriela. I'm an exercise physiologist and a tobacco treatment specialist, and I work in the medical rehab department doing cardiac rehab, pulmonary fitness, and movement as medicine.
unfortunately, one of our colleagues, Essie Moverman, is not able to attend due to an illness tonight. And let me just say, she is not only a colleague and a friend, but she has been my mentor since I was 24 years old. So this is for you. So let's just say that Essie started with the building blocks of this foundation, and this was 15 years ago. Let's go through some milestones. In 2009, the launch of Monadnock Community Hospital's tobacco treatment program started with the Great American Smokeout. Now this has been going on since 1977. It comes up every year. It's a day of support to get people to quit smoking, or to at least plant that seed. And that is when we started here with our tobacco program. Hard to believe that in 2009, we only were spending about 4 cumulative hours on each patient. And now, boy, it seems like it could be 3 or 4 months. We started to ask for provider referrals. Actually, they became required. Then in 2010, we purchased our first CO2 monitor, CO monitor. We also had a group program from 2015 to 2017, and that entailed a health and wellness coach as well as a tobacco treatment specialist. And then in 2019, this campus became smoke and vape free. And we were worried people were going to be a little bit fussy with that, especially the visitors. So we ended up coming up with a comfort care kit, which was a bag of items and tools and resources for our smokers that were on campus. And believe it or not, we got some calls after that asking, hey, we got one of those comfort kits. Can I come in and maybe have an evaluation and sit and talk with you? 6 years later, those comfort kits, we're still making them, and they're still requesting them at all of the different doctors' offices and here at Monadnock. CO monitoring. What is carbon monoxide? Well, usually when we hear about this, we're thinking about a faulty gas boiler, or we're thinking about car exhaust fumes. We never think about it as a byproduct of smoking cigarettes, but it absolutely is. And CO monitoring can actually pick up a measurable amount of CO in the bloodstream. And we use this as clinicians to help with treatment plans. So this was a game changer. This was a privilege. Our hospital was able to supply us with 2 of these. It's instant, it's non-invasive, it works to encourage smokers to quit, and it measures their progress while doing so. Boy, have we grown. So let's look about how have we grown. So this bragging right is for Essie. Since 2009, our tobacco treatment counselors have increased from 1 to 3. In 2009, we also successfully explored and received grant funding to get it off the ground. We were fortunate in getting NRT, which is nicotine replacement therapy, patch, gum, and lozenge. They were taking it on their dime, and we were letting patients come in, and people that could not afford it, and this is still today, we were supplying that, and this still continues. We have one of the strongest, most robust programs in the state. Very few hospitals only have 1 tobacco treatment specialist. Through collaboration, commitment, and creativity, we have crafted a program that continuously grows and improves. We have broadened our scope to include vaping and other non-combustible nicotine products. No cookie cutter program here. So let's talk a little bit about the process here at Monadnock. So first, we get a referral from your provider, and we receive that referral, and then we give you a jingling on the phone And we set up an evaluation after we've talked a little bit about our program. And we're pretty in-depth, as you know. We ask about everything. This is about 60 minutes long, sometimes an hour and a half. We ask about your smoking history, your relevant medical history, your social environment history. Are there smokers in the home? Do you work with smokers? Do you have social family support with your quit? And what is their readiness to quit? How ready are they? And then we assess stage of change. So here's the stages of change. There's 4 of them. Pre-contemplation is when you're not considering quitting. This is when your doctor sends you to us and you're like, yeah, no, we're not doing this. And we find that out in the evaluation pretty quickly. Contemplation is, well, yeah, I'm pondering it, I'm thinking about it. Preparation is, I think I'm ready. I think I'm ready maybe in the next month or 2. And then action. Action, you would either have quit or you're in the process of quitting. And we get evaluations and we see patients all the time in very different stages of change. Motivational interviewing. Well, what is this? This is a collaborative conversation style where we ask questions to help strengthen your motivation and your commitment to this change process. Working through ambivalence. This is tricky. This is when the patient is feeling torn between positive change and loving the substance use. And you can so see this conflict, especially during the first 3 to 4 visits. Our goal is to explore both with the patients and obviously support positive change. Motivational interviewing can elicit change talk. What's change talk? Well, we have an acronym of DARN C. So as tobacco specialists, we want to know, do you have a desire to quit? Do you have the ability to quit? What is your reasoning to quit? Do you need to? Are you committed? And these are all questions without shaming, without blaming, without throwing how naughty it is and you're going to get sick from smoking and pulmonary disease. We're not about that at all. We literally want our patients to reflect on why they should and need to change, and this really authentically needs to come from their self. And we are very patient and supportive with this process. The other thing is we're measuring what is their level of dependence on nicotine. So we have a questionnaire. It's called the Fagerstrom scoring system. It's a tool used for assessing the intensity of addiction to nicotine. The other is the Smokalizer, which we've already mentioned, and that has a quantitative number. It's a measurable number when you blow into it. It starts at 1, which is a non-smoker, and goes all the way to 60, which is a dangerously addicted smoker. So it's quite the range there. But this is important for us to know the level of dependence, because that will help us plan a treatment plan with our patient. Because if they're very heavily addicted, we might need to use NRT, which is nicotine replacement therapy. Sometimes we have to double up on it and use other avenues to help with the nicotine craving.
So,
yeah,
sorry.
and I'm going to hand right over to our treatment specialist here, and she's going to talk about pharmacotherapy.
So to make an effective treatment plan, we want to address both aspects of nicotine dependence. So that would be the physiological part and the behavioral part. The physiological part, we would want to treat the actual addiction to nicotine, the physiological part of addiction, which we would treat with pharmacotherapy, which we'll get into on the next slide. And then behavioral aspect, we want to treat the actual behaviors associated with smoking, which we would use the cognitive behavioral therapy and motivational interviewing. So this is a form we give every patient we see during their initial evaluation. It's more towards the end after we've evaluated all of their history and all of those topics in our evaluation. And we go off of the dependence, the Fagerstrom score and their CO level and those factors. So we have over-the-counter options and we have prescription-only options as well. We have the nicotine patch, which is the long-acting nicotine release. It's absorbed through your skin, so you want to put it anywhere on your torso between your neck and your waist. Usually people put it on a non-hairy area, so maybe the back of your arm. And we want to make sure we put it in a different spot every day. So every time you wake up, usually in the morning, you're going to put one on and keep it on for 24/7. You can wear it in the shower, you can wear it to bed. If you do have issues with sleeping, it could cause insomnia, so in that case, you could just take it off right before you go to bed and put a new one on in the morning. And you still get that same long-acting effect. With the gum and lozenge, these are the next two over-the-counter options. These are fast-acting, kind of for quick breakthrough cravings. So if you have the patch on and you have a breakthrough craving, you can pop a lozenge or pop a gum. A lot of people, there's a big misconception with them, and they could cause adverse effects if you don't use them properly. Nothing super scary, it just might cause an upset stomach if you're not using it the right way. So with each product, you want to make sure you're either sucking on it until you taste a peppery, spicy taste, or chew on it until you taste that taste, and then park it in between your cheek and your gums. That way it absorbs, the nicotine absorbs through your mucosal membranes rather than into your digestive tract if you're chewing it like regular gum. The next couple, we have the inhaler and nasal spray. Those are prescription only, and actually the inhaler was discontinued in 2023 due to just an exhaust of their inventory, and they just decided not to continue making them. So we really only have the nasal spray that's prescription only. It's also very expensive, but it is the fastest acting nicotine because you're doing it through your nasal passageways. So it's going right to your brain. So side effects to this, it could cause throat and nasal irritation, runny nose, watery eyes. Don't use it if you have nasal polyps, asthma, or allergies. It's not best suited for everyone, but in some cases it is. The next two, I'm gonna just skip over because we'll talk a little more in detail about those in upcoming slides, but those are the main nicotine replacement options that we use for our patients. Sometimes in combination, which has shown to be more successful for people if they can tolerate it well. And so as you can see on this slide, these are the most common withdrawal symptoms or side effects when quitting smoking. And just a quick timeline, knowing most symptoms when you quit manifest in the first 1 to 2 days of quitting and then peak within the first week. So it's important to use NRT or medications on top of the cognitive therapy as well, as you may be struggling with some withdrawal symptoms in that time. But we always tell our patients that those feelings won't last forever. We just got to get through these first hard few weeks and then continue, and it'll be like you never started in the first place, as far as physiologically. And so over usually a 6-month period, we can use NRT. It's recommended between 8 and 12 weeks, but we find that people need that longer, and the risks don't outweigh the benefits. We would prefer people to use NRT rather than smoking, so it's okay if that's long term. Nicotine replacement, I also want to mention, is clean nicotine. It doesn't have any of the additives like cigarettes or any other tobacco product. It's just that clean medicinal nicotine, so it is safe to use. And it is safe to use in combination as you're trying to quit smoking. So a misconception is you have to quit before you even consider using nicotine replacement therapy. That's untrue. How are you supposed to quit if you don't have any help with the withdrawal symptoms? Because that's a huge part about quitting. So how we decide the factors in selection of pharmacotherapy for everyone, it's always going to be different, but we do kind of have our method. So we check out their level of dependence, so what was their CO number, how many cigarettes are they smoking a day, when do they have their first cigarette in the morning, the effectiveness of NRT, side effects they may have experienced in the past, and the ease of use, convenience, medical history, and just prior use of it. Some people have used nicotine replacement in the past without instruction or information from a pharmacist or a provider. They kind of just buy it and read the box, and that's fine too, but again, that could lead you astray. So knowing that maybe they had adverse effects in the past, but maybe they weren't using it correctly. So we would just revisit that, and if they still don't want to use it, that's okay. It's always going to be up to you guys and your choice. So we do tend to go over that again, just in case. And sometimes people experience they can tolerate it well, and this time it was a success compared to the first time. So getting back to other nicotine replacement therapy, instead of the fast-acting, this is our medications. So we have varenicline or Chantix, and then bupropion or Wellbutrin. Varenicline blocks the effects of nicotine from cigarettes, and it produces sustained levels of dopamine release, thereby replacing some of the effects of nicotine. So it's giving that perfect amount of blocking certain receptors in your brain and also allowing them to feel the nicotine effects, so you don't go through withdrawal symptoms as severely as you would otherwise. This is actually the most successful nicotine replacement option, but sometimes people have adverse effects, so that could not be an option for them. In 2016, actually, there was a black box removal of this medication after a large clinical trial showed that the neuropsychiatric side effects were actually lower than previously suspected. So this scared a lot of people for a long time because there was that black box warning, so just meaning, it's going to cause severe adverse effects, kind of stay away, but that was proven otherwise, and now this is one of our most used nicotine replacement therapy options and the most successful. And then getting into bupropion, our other medication, or Wellbutrin is another name. This one is used for antidepressant or for depression or anxiety, but it has also been shown to help with the same thing in your brain. PET scans have shown brain cells to be involved in the drug craving do not activate with bupropion on board. So this has been used frequently for people who are also experiencing anxiety, depression, who isn't when they're quitting smoking? Quitting smoking is a huge change in your life, so it is common for people to experience those symptoms. So this is another great medication. These both would be prescribed by your doctor, and we collaborate closely with them to make sure we're giving someone the best care, and that way, they know their medical history more in depth. They're the doctors, they get to prescribe them, but we can recommend them if we find that's appropriate. Positive strategies.
So now after we go over some of the pharmacotherapy treatment options, some patients use it, and then there are other patients, respectfully so, that don't need it or want it. But all of them get this, the counseling part. This is the cognitive strategy part. This really is the challenge, I would say. The nicotine addiction is one thing, but the behavior piece is I would say, probably the harder part for the patients is what I view. Thoughts and emotions trigger smoking, creating this vicious cycle. And as you can see, I put a whirlwind of a tornado in the middle of that, because that's exactly what it reminded me of. You have a stressful situation, it leads to a negative thought, which influences behavior, and that leads to emotions triggering smoking. And this is cyclic. Our job is to elicit change talk. Can we get our patients to identify their negative thoughts and patterns? How do their thoughts influence their behavior? And can we help them with a new approach to the way they're processing and thinking? And the second piece, the behavioral strategy. Identify a negative behavior and replace it with a positive one. So identify actions that can replace tobacco use. An example of this would be to replace hand-mouth action with something else. And what works for one patient does not work for another, and vice versa. This is really tailored individually and what works for one and not the other. Another suggestion is sometimes we tell them to switch up the brand of cigarettes to something less desirable, and sometimes that helps. And can you measure behavior? Is behavior measurable? Well, we have figured out a way that it can be. We have something called pack wraps that we give to our patients. Some use it, some don't. And basically it is a log or diary that is attached to your cigarettes, and the need to smoke is scaled from 1 to 5. The other thing we use for people that the dog ate my homework is a clicker, which is a trackable number. And we actually use a baseball, what is it called? A pitch counter. It's actually is what we came up with. And it was actually a friend of mine, a dear friend of mine, that actually came up with the idea. And I'm like, this is a great idea. And the other thing is changing your environment, because we are creatures of habit. We are so creatures of habit. So changing up your routine in the morning, you know, I know myself, I go downstairs, I let the dogs out, I turn the Keurig on, I put the K-cup in, I run upstairs, then I run back downstairs, let the dogs in. So, you know, I literally have this down to a science, and it's going to take me 3.5 minutes to get back upstairs. So changing our routine can really make a difference with being successful with quitting.
Can I also say an example?
Absolutely.
So recently I have a patient now, and she has decided she has her checkpoints when she goes to work. I feel like a lot of people have those checkpoints when they're driving, if driving is a trigger for them. But she decided to go a different way to work one day, so she would completely erase her checkpoints and kind of start fresh. And that seemed to work for her for about a week. And then she got stuck behind buses for school because school had started up. So she ended up going back. She's doing great now, but that was just a small little change in her routine that seemed to help immensely for her.
Yeah.
So
Absolutely.
just little things like that.
And the other thing is, so this is our creative tricks and tools. And some of these might be new pieces from Van's time, but obviously the smokealizers, tried and true. The new one, which is the pitch counter, and we have a dual one for our dual users who smoke and vape, which unfortunately is becoming more common. And we also now have bamboo straws and how to use the flex. The flex up there is made of silicone, and it's malleable. And you can't see it, but there's some raised bumps on there for people that are super fidgety, and if you want to keep it in your pocket. You can also inhale through it. A lot of people miss the hit of the smoke on the back of their throat, which is why we use these straw-like devices, is so that they can actually use that instead of smoking. So the last slide here is relapse prevention strategies. The entire tenure of time with us here, we are providing strategies to prevent slips and relapse. And within the first 6 months after a quit, you are still very vulnerable for relapse. And if this happens, a slip or a relapse, we're here. No judgment, just pick up the phone.
And try again.
And try again. So some of the resources, I'm going to start actually on the right-hand column. Smokefree.gov is a great resource to send our patients home with. TheTruthInitiative.org is actually an interactive app that actually will send text messages to you. Nicotine Anonymous is another great one. You know, another strategy is, what is the lifestyle balance? How is your nutrition? How are you sleeping? Are you exercising? And because of where we work, we're super lucky that we are able to contact PCPs easily and advocate and ask for, maybe a diagnostic for a PFT or what have you. We're just super lucky that we have access to a nutritionist, and et cetera. And obviously the support from the MCH tobacco treatment specialist. We are always here to help. And like I said, there's 3 of us, and I will hand that over to Gabby.
Yeah, we also like to remember our self-management. What are we doing to keep us in check? Where's the accountability? We want to make sure we're following the plan that we came up with together and that fits into your routine comfortably and appropriately to, keep practicing these relapse prevention strategies. And then we also touch on the 4 Ds: delay, drink water, do something else, distract. And deep breathe, sorry. But we want to practice these throughout our day, remembering that cravings last between 5 to 11 minutes. It's only that long. Taking 5 deep breaths, doing something else for that time, brushing your teeth. It doesn't have to be this huge extravagant chore, just doing something else. But remembering the craving won't last. And then psychosocial support. We want to make sure we have people in our corner supporting us, at least maybe consulting into one person at least, or just, confiding in that one person if you have that one person. I mean, it would be great to have a whole team, but some people don't. So just having that one person, and it could even just be one of us, to keep you in check, or just be there if you need it. But making sure you have some sort of support is super important.
So that concludes our
References.
as well as our references, our slideshow as well as our references. And now to the fun part. So I want to thank Tatum and Brian and Van for your loyalty to us, and coming and being on this panel. This is super special. I'm going to start just by asking. I'm going to start with you, Van. So I was Van's tobacco treatment specialist. And I'm gonna,
Sure.
I've known him for years. He's actually done pulmonary fitness a couple times with us. A few, many times.
Several.
And he knows where to find us if he wants to come back. But what made you decide to quit, Van? At that time?
At that time? Probably feeling that I just physically, I was finding it harder to breathe. Of course, now I'm on oxygen, so.
Yep, so Van at rest does not need oxygen, but during the pulmonary fitness program, we realized that he's got a great paced walk, but we realized that his breathing gave out before the legs. And so we applied some oxygen to him while he was on the treadmill. He definitely get more bang for his buck, but he is, with exertion, higher levels of exertion, he needs oxygen. And I can't imagine if you hadn't quit,
If I hadn't quit, I probably wouldn't be
where
here.
we'd be. And how many years quit are you?
January of 2018,
So 2018.
7 years.
7 years?
Yep, so for 7 years.
Almost 8.
Yep.
Yep.
After 65 years of smoking.
Yeah, so it's possible. 65 years of smoking. What do you think was the hardest part of quitting?
I liked it.
Yeah, that's honest.
I did. And I've got my little binky to this day.
It's the last
Quit.
one,
It's
because they
the last
discontinued
one.
it.
So, Van, how many packs a day were you smoking?
About 2.
So it was about 2 packs a day, which is a lot of nicotine. There's 52 milligrams of nicotine in a pack of cigarettes, approximately, depending on the gram we're talking about. And he had a very high, if I remember, number on our smokalizer. So he had the patch,
I tried that.
the inhaler, gummer lozenge.
I've tried that.
Yep.
Tried,
So,
let's see, hypnosis. What's the one where they stick needles in you?
acupuncture.
Acupuncture. tried the lozenge, tried the patches. Finally got to meet her and got me through it.
Yep, well, it's definitely, he wanted it.
And
There's some mental toughness that goes along with it. There's good days, there's bad days, and then there's quit days.
Yeah.
Hand mouth stimulation, so that's what he uses for, still to this day. He keeps this pseudo or faux inhaler in his
This-
jacket.
in my pocket, just I've got it with me all the time. It's empty. It used to be nicotine in it. There's a little cartridge in it that used to be in nicotine. I kept it there because it gives me a little back pressure from sucking on it, but
Yeah.
I just do that instead of a straw.
Yep.
I don't know, my dog gets mad at me.
Yeah, well done.
Whatever works.
Yeah, whatever works. Congratulations and thank you so much for being here. So Brian is another one of my patients. He is a more recent patient, a more recent quit.
Yep.
And what made you decide to want to quit?
Well, I think the impending birth of my third grandchild, and it was time. It had been 50 years, give or take. It was time. So I just told myself it was time. And then the big question was, how?
Mm-hmm.
That's when she got involved.
That's when I got involved. What was the hardest part of the quit?
I think the hardest part was on the behavioral side, it totally eliminated my excuse to get away from people, to get away from the family, go outside, find a nice quiet corner, have a smoke, or during work to get out of the office and go hang out with the smokers. That was a big piece to it. Later in my working career, I was working remote from home, so there was nobody to escape from, so it was just an automatic go out on the deck. And I never smoked in the house. That was never allowed. But that was the biggest miss, I think.
If I remember correctly, you did not do nicotine replacement therapy?
I did the patch.
You did do the patch?
Yes,
okay.
I started with the 7s and went up to the 14s, or
Yes, okay.
And then
There was a
went up and down, and I tried a lot of different tricks. I tried cutting half the cigarette off and throwing it away, and I laughed at myself at one point, saying, "You're just an idiot. You're either going to quit or you're not." So I just put them down. It was a week before the expected date of my grandson's birth, and I put him down and said, "Okay." I told Dawne, I said, "I'm going to do a soft quit, see how that works out." And I never picked one up after that. So that's all there was to it. Yeah.
The soft quit was a hard quit.
Yeah, he said that, I'm doing a soft quit. I said, this is the first time I've heard this, a soft quit. Now
I like
explain
it.
this.
It gave me room to back out if I
Yes,
lapsed.
he didn't want to make the full commitment quite yet, and he wanted to see, am I capable? And he found out that he was.
Yeah.
And I think, listening to him, we self-soothe with our cigarettes, and we use them as a coping tool. And it's a hard thing to let go. It's kind of like letting go of a friend that we really loved, but we knew was not good for us. And so we watch our patients through this grieving process, and I would totally say it's grief. Grief has no limits and no time, as we can say. So a lot of patients say, well, when do you think I'll be quit? And really, I don't know. I don't know. It's a process, and it's a patient process. Yeah, so congratulations.
Thanks. Well, I want to add one other thing. I kind of had a leg up on this program when I joined because, I don't know, 15, 20 years ago, I quit drinking. I went to a 30-day outpatient program at Concord Hospital. I'm an alcoholic. So having gone through that course and that training taught me a lot about addiction. So by the time I met Dawne, she's throwing all these terms out, like, yeah, heard it, been there, done that, got it, okay. And I just had to apply it to smoking, and it worked.
He took out some tools from a treasure chest from long ago.
Oh, yeah.
That worked and applied them.
Mhm.
And I think sometimes we just need to be remembered. You know, we all have coping techniques and we all have tools from life experiences, and sometimes we have to kind of redig those out and say, what worked then?
Yeah, exactly. Tatum.
Yes.
And who did you see for tobacco?
Essie
counseling?
was my pulmonary therapist, my smoking cessation goddess.
Yes.
So Essie helped me with my journey, and a journey it has been and still is to this day. I guess I don't have any one reason why I quit. I had multiple reasons. However, the one that forced me to get me to do my soft quit
Mhm.
was I was 5 years past due for neck surgery. I had to have total disc replacement in my neck because of the just extreme pain. I had pinched nerves, all kinds of things, and my surgeon would not touch me unless I had quit smoking. Well, the pain won, and it was so bad. And I did also, I have done this program more than once. I did try it 5 years ago with Essie, and I was successful at the time. I just fell off the wagon. And it was as easy as that. And I thought, this time around, I knew it worked before. I knew I could do it again with the help of Essie, because I know I couldn't do it by myself. My husband quit 2 years before I quit. He quit cold turkey. I don't know how. He did it.
He's the 7%.
He did it. And he sure rubbed it in my face like you would not believe. And there's nothing worse than a quitter who's wanting you to quit too. They are diligent. And I was able to do this program with the experience that I had from my previous experience. But this time I knew better. I knew there were no more excuses. There were no more reasons. There were no more if, ands, or buts. It's just do it. And I'm for multiple reasons grateful that I did, because I did have my neck surgery this past July. And I have been, this month will be my 1 year anniversary of not smoking.
What were tools that you use and still implement?
So for my tools, deep breathing has always been a part of my family's life. My grandmother always told us all that when we needed to chill out, just to everybody do some deep breathing. So we'd always do deep breathing for my nanny. As far as, what do you call them? PFTs, the actual PFTs. I would use the smokalizer, and I would put that on my refrigerator like an A+ student. Every time it would go down and down and down and down and down. I'm like, yes, I'm doing it. See, I'm doing it. And it was to have that praise. That in itself was a tool. I tried everything, but I chose lozenges for my I needed the quick hit to get past the craving moment to start with. And I also was on bupropion.
Same thing.
And I am still on it. And it was duo for me because I had just lost my father the year before I quit smoking. And I didn't realize how sad I really was until I started feeling better. And I was feeling better from quitting smoking, and I was feeling better from the bupropion. And it helped me learn new coping for all different aspects, to cope with guilt, and there's guilt with smoking, and to quit, and to help with grief, because there is grief with smoking, or quitting smoking. And you're absolutely right, the tools are there for a reason, but overall, Essie, and you guys, but Essie was my greatest tool. She was always there for me, always. I mean, the hard part is I also work at this hospital, so I couldn't go out on a smoke break. There were no vaping, smoking, or anything like that. And I only started working back at this hospital after I had started the program again with Essie, and I couldn't get away from her. There's no fooling that girl. You know, there was every excuse in the book, but no, not with Essie. She'd check in on me and I'd report back to her, but she always made me feel good and she was proud and that made me feel good. That was the new hit that I needed. That was a reward too in itself, being like, oh, somebody other than me cares, you know? And it's just awesome. So Essie was my biggest tool.
You answered my next question.
Okay.
What are the benefits you've already noticed
Yeah.
since quitting? But
Yeah.
you
All the
kind of
benefits.
explained
I'm
it.
not the stinky grandmother. I'm not.
Right.
I happen to work in oncology, and there's another reason why smoking is a huge part of my everyday life even still, because I see the other sides that it can have, and I also don't want people to have to smell that smell we all know all too well, especially on a rainy day, you know, or when it sticks to your clothing or whatever. It's different, and I do miss it. I like Van, I liked smoking, and I may only be 50 years old, but I smoked for 40 years. You know, I was sneaking them at 10 years old, and by the time I was 12, I was just out of control and got what I wanted when I wanted it, and I just don't, I'm just so grateful. There's nothing more that I can say other than I'm grateful that I've reached this point with the help of this program. So, thank you.
That's amazing. You answered all the questions.
Yeah.
I don't idly have any left, but what are you most proud about, or what do you miss most about smoking?
So I had to write little notes because I am an ADHD person. I am all over the place, and again, that was part of my addiction, was just that oral motor fixation and things like that. So I had to write notes. You touched that my husband quit cold turkey. I needed a plan with support. There were plenty of triggers, plenty of situations and excuses. You find a way around those. Off-brand cigarettes was my first go-to. I was a Camel girl through and through, and I just loved my brand of cigarettes, and the cost was, of course, so expensive. And I'd go to the Dollar General and say, give me the cheapest brand cigarette you have, and oh, they're so gross. So that was another reason for me to smoke less. But it takes, here's my ADHD, I forgot the question, but it takes bravery and strength to be able to do this.
And creativity.
Absolutely, and like I said, I was shocked when you guys said this is pretty much the only program available at this time. And I hope for everyone who wants to quit that there are more tools such as this program available to the general public. So I couldn't have done it without you. Thank you.
You're so welcome.
Thank you both, yeah.
Thank you all.
For sure.
We appreciate you.
Well,
Guys, the hard work.
Yeah, you did all the work, you did the work,
Mhm.
just the support and the tools, but I want to thank the panel for coming all the way here. You know, I just think it's above and beyond, and I'm flattered that you guys came, showed up, super excited, and I hope this gives our community, our patients, our employees, hope. I also want to remind the community that if you cannot afford NRT, which is the patch, the gum, the lozenge, the nicotine replacement therapy, that we have that grant and we are able to help with that. And for employees, it is free tobacco counseling, and we have vouchers for them. If you're watching this, come see us.
And we can instruct you on how to use everything too, properly, but yeah.
Thank you.
Can we ask them questions or?
Yes, absolutely. Are you comfortable with
Absolutely.
Q&A
Sure.
now?
Yeah.
Yeah.
What did your family do, like, best support you? Or did you, or, you know,
I couldn't hear.
what did your family do to best support you? Did you kind of stay out of the way, or?
Actually, I'll say,
That's an interesting
my
question.
family was not supportive. My husband just razzed on me because he quit and I didn't. I desperately needed this program, and I needed that support. Yes, my kids were good about it, like, yay, mom, good, but they're like, whatever. because I didn't smoke around them. We also never smoked in our house, and it was what I did when I was by myself, where I go have a moment for myself. So there wasn't enough support. My dad would have been my biggest supporter, but I just lost him. Same with my grandmother, who I lost shortly before that. My support network was gone. So therefore, Essie, she was my shining star, and I couldn't have done it without her. And then since quitting, my rheumatologist is proud of me, and he says it. It's just like, they really are proud of you when you do it. And your doctors are rooting for you. I promise you that. They really, really are. And I again, couldn't have done it without her because I didn't have a whole heck of a lot of support. I felt very alone, but not with these guys on board, so.
I had the opposite. I had all kinds of support from a daughter that, I think she was in the 3rd grade. First time she asked me to quit. Oops.
Take a second.
So I have 5 kids, and they're all too afraid to talk to me for whatever reason. Not really. I mean, we do talk quite a bit. They're all old and older now. But they would talk through my wife. My wife was constantly telling me, you got to quit. You really ought to quit. There wasn't a lot of pressure. I was still the breadwinner of the family. I did a lot of the work around the house, and it's, I'm going to go out and have a smoke. I'm going to go out and have a smoke. So that was, but the support was there. My grandkids were more verbal about my smoking, and they're 4 and 6, well, 5 and 7 now, thank you. They were more supportive of my quitting and verbal towards me about that. And that's what really kind of dug at me, much like your daughter. It's just, you hear it from a little 4-year-old. Papa B, why do you do the smoke sticks? That's an interesting question. Why do I do the smoke sticks?
It's hard when you don't have an answer.
To a 4-year-old that he would understand. So, you realize you're doing something really stupid. So.
But it is an emotional journey no matter what.
Yeah.
It can be very emotional whether you have support or not. So.
And what was the other question? Oh, about frustration.
What did they do that frustrated you?
They who?
Your family, like,
Family.
did your family at any time frustrate you about smoking? That when you couldn't smoke, like, were they frustrating you, like, hey, don't smoke if you cheated or anything? Like, what did they do that annoyed you that you could tell the spouses or family members not to do?
Oh, I don't mean to badmouth my husband, but
Since you brought it up.
I mean, he quit a good solid 2 years before me, and when I'd say I need to go out when I was in the program, yes, you're still allowed to smoke through your journey, through your process. And it was brand new and in the beginning, and I was just having a moment, and I said, I need to go outside. And he's like, loser, quitter. Like, he was being a turd. Pardon my language, I know this is going on, but it was not supportive. Yes, when I finally did quit, he is proud.
Yeah.
He just didn't know how to show it during the time of the process. But it is annoying when someone's riding you constantly, and it only makes you want to smoke more sometimes. So,
For sure.
because you want to get away, and you're like, just leave me alone. And that's what you do when you're alone. So the more support you have from loved ones versus, and I'm sorry to use the term nagging, because that's what he did, you need support and understanding and patience. You absolutely need patience, because it can be not just annoying, but defeating. So.
That carbon monoxide monitor really drove me. That was a competition.
Yeah.
I mean, I was competing with that thing. I was not going to go in there and not have a lower number.
We would
Did you bring it with you?
I
I was
don't
gonna
have
say,
it.
just to show an
But
example to someone.
it's about
It's exciting
this
to see
big.
how it works.
Yeah.
It's just kind of like a remote control size, and you blow into it after inhaling for 15 seconds, holding your breath for 15 seconds, and then blowing out. We would do it every single follow-up session with our people, if they were okay with it, which most people were, because like Van, many
It's
others
motivating.
looked forward to it because they would challenge it. That was their motivating factor. And all they would want is that lower number, because the lower you are, the better it is, obviously. So
And you can't cheat.
you
No.
can't.
Yeah.
There's just
Yeah.
no cheating
Only
with this
cheating
thing.
yourself.
so.
cheating.
Yeah.
And we would track those numbers by putting it into a graph, and it could show a line graph showing the decrease over time. So that was a huge motivating factor. I think you said you have it on your fridge.
Essie was like a teacher. She put a gold
Yeah.
star sticker on it for me,
great.
and I was like, yay!
And we do the same because of her, because we thought it was a good idea.
Yeah.
I think the other benefit the Smokalizer has is when patients try to go off on their own and quit, you know, they go to Walmart or Rite Aid and they're looking, they're like 7 milligrams, 14 milligrams, 21. Okay, this patch, how much gum do I need?
Yeah.
It's really overwhelming. And we have the tools so that we can, you know, do a better treatment plan, if you will. So, you know, when you're smoking and you blow a 40, we're like, whoa, okay, at least we know where we're at. This is your baseline, and this is how much NRT or nicotine replacement therapy that we recommend so that we can help with those cravings. Because we don't want you squirrely, we want you comfortable. Do you have a question?
No, I've got a statement that replacement therapy for me has been as detrimental as smoking cigarettes
Mhm.
throughout
Yeah, and
most of my last 20 years of life.
Yeah.
I quit nicotine replacement. I figured as much nicotine gum that I put in my system each day
yeah,
was almost equal to the 2 packs of cigarettes that you smoke as far as the amount of nicotine
yes.
going into my system, which is not a healthy lifestyle.
No, it can actually create anxiety and restlessness if you have, if
Heart
you're
disease.
using.
I mean,
Yeah.
nicotine is a drug that is not healthy for you,
Yeah.
period.
It is, and,
So
yeah,
I'm reluctant to suggest, but I know the reason, but I'm just saying that cold turkey for me. I mean, I quit for 6 years.
Yep.
Christmas, I grabbed a pack of gum, and
Yeah.
here I go again, maybe 10 pieces a week.
Yep.
But still, I can feel it creeping back
Yeah.
as okay, it's an addiction. It's
Nicotine
nasty,
is
nasty.
absolutely an
Whether I'm
addiction.
smoking a cigarette or
yes.
putting it in my system,
And-
it's such a drug.
It is, and we only use it as a bridge.
Yeah.
We
And
need,
that's what I'm saying, I'm
Yeah,
just
it's
trying to tell
only
my
a bridge.
story
Yeah.
so that
Yeah,
it's part
great.
of the therapy for me. It's like,
Right.
all right,
Yeah.
I'm glad I came, and I know the only thing that is going to, because it's been 9 days.
Yeah.
My wife works here, she said, she's the one who sent me the email, I said, all right, I'll jump in. 'Cause I will, I have, and
Yeah.
I will again.
Yeah.
And I'm kind of bound and determined, because I get a physical in 40 days.
Yeah.
So it's like, okay, my incentive is like, all right, cut the gum out, I
Nice.
can do it. But
Yeah.
geez, I was ugly the first 3 days.
Yeah.
Yes.
Yeah.
The whole
Within-
psychological
yeah.
things that got there.
Psychological is true.
Yeah.
I still have the bottle of my lozenges
Yeah.
as my safety net, because,
But I mean, I became.
Right,
I
addicted to
I
them.
Get up in the morning, and because I did the pouches for a long, long time.
Yes.
I really smoking, but I went through the gum, cheating gum,
Mm.
you know, that
Yeah.
stuff was just nasty, so
And-
it's just in my bloodstream,
Yeah.
so
And-
I'm glad you guys
and-
rated it.
Yeah, and
Yeah.
nicotine replacement therapy, we don't use for everyone, just depending on, you know,
Understood.
their
Yes.
experience.
Yeah.
But the biggest part is the behavioral modifications and having the support of someone to just speak to. Everyone
Yeah.
wants to feel validated. Everyone wants to share their experience,
Yeah.
and that's the biggest part of it.
That's kind of
Yeah.
what I just did.
I
Yeah.
value your feedback.
Yeah.
I think you're right. I think nicotine, the replacement in of itself, especially if you're not in counseling, you can end up in a pure cyclic addiction
It
of that.
was ridiculous. I mean, my wife worked here she still does, many, many years ago. And
Mm-hmm.
free therapy, so I did the gum right up through, then I did
Yeah.
the patches right up through, and I could do
Yeah.
it twice, so I did it twice.
Yeah.
Got addicted to it.
Jesus
Yeah,
Christ.
Yeah.
definitely behavior modification and
Yeah.
cognitive change.
Yeah.
Yeah.
And I would say that's harder part than
Yeah.
the addiction.
The psychosomatic.
Yeah, the psychosomatic.
thanks for
Thank you.
sharing that.
Thanks
You're-
for
Yeah.
sharing.
Thank you.
I
Thanks
think,
for,
yeah,
Thanks for letting me chat. 'cause,
Absolutely.
I'll make it, and I've got your phone number, so.
yeah.
Good.
Thank you.
And he knows where you work.
Yeah.
Yeah, get a
We're here to
referral.
support you,
Yeah.
absolutely.
Thank you guys very much.
Thanks.
Thank you.
So what is the next step?
So if you want to, see one of the tobacco treatment specialists, then you just have your provider send a referral, and then we call and do a very short screening, and then we set up an evaluation that lasts, between an hour and a half, and come up with a quit plan.
What, I mean,
And
and
then-
then we don't need a referral, like, well, for our insurance, if that's what you're referring.
Yeah, it's really, just really the doctor saying,
Yep.
yeah.
Yeah,
And that information where we send that referral is here?
yes, it's right in that brochure,
Yeah.
our fax number's on there and everything.
Yep. And I can say that, if even we planted seeds today, even if we just planted a seed, that's okay. You know what? That's okay. Because it really is a process of, you have to be ready for it. You have to be ready. It's a big commitment. Obviously worth it. Obviously worth
And
it.
taking all this information into account, we try to make it as comfortable as possible, but it's always gonna be uncomfortable. You're gonna have a lot of discomfort through it, but that's why we're here for your support and,
Yeah.
using all those tools, so. Thank you for
So
coming.
thanks everybody. Thank you
you.
Thank
so
you.
much.